The August 2017 United Nations Population Report puts the population of Nigeria at 192 million people, with a population growth figure of 2.6%, GDP growth rate of negative 1.5%, inflation of 17%. It is estimated that more than 6 out of every 10 Nigerian lives below the poverty line. Hence, the need for poverty reduction by building sustainable livelihoods. Sustainable livelihoods can be achieved in Nigeria if we understand how the people gain access to food and non-food needs for survival or livelihood, and ensure that policies and interventions are informed by this. The Household Economy Analysis (HEA) provides this information.
HEA is a framework that analyzes the various strategies households adopt to obtain access to the things they need to survive. It helps understand people's food and non-food needs and further determines the level of assistance required by household, whether short-term emergency assistance or longer-term development programs or policy changes.
It's ideally profiling households and knowing the profile of households. HEA looks at households like in 4 main categories. We have the poor, the very poor, the middle class, and the well-off. And what HEA hopes to do is it helps you to provide characteristics that can use in every community to know what do the poor people do, what do they eat, what do they feed on, basically who is the poor.
In Nigeria, HEA was initiated by Save the Children in 2010 as part of the HEA Sahel Regional Project, previously funded by Office of Foreign Disaster Assistance (OFDA) of the USAID, but currently by European Commission Humanitarian Aid Office (ECHO), and it covers 7 livelihood zones across 5 states of Bauchi, Jigawa, Katsina, Zamfara, and Borno states.
One useful information for the Director of Budget and Economic Planning from HEA is the livelihood information generated from baseline. The information helps the Budget and Economic Planning Directorate in planning toward economic growth of the states.
In the Ministry of Agri, prior to information from Save the Children on HEA analysis, we've been having a gap of some information that has to do with livelihood. Household economic analysis really help us in the Ministry of Agri in terms of planning how to direct our input supplies to the farmers.
HEA actually is about poverty analysis. Poverty analysis means going to meet the target farmers, means respondents, interviewing them, getting the right information from them, and this information is you are going to use a tool to analyze the data, and when you analyze the data, you interpret the result, and these results are going to be used for policy formulation, execution, and implementation.
As an early warning tool, the HEA is a key element of the Harmonized Framework (CH), which deals with the analysis of food and nutrition insecurity in Nigeria.
The CH has the same implementation as the IPC, although we know that the CH has been a planning and monitoring tool for food security situations, especially in the 17 West African countries and Nigeria inclusive.
Information from HEA baseline and outcome analysis has been very useful in intervention programs around Nigeria.
The program, that's the Ankoboro program, has some pattern or relation with the HEA. Under the Ankoboro program, we give soft land to the farmers. He is given certified seeds which he can produce, which is a high yielding, and he can produce more food that will satisfy them throughout the year.
My primary focus is the Child Development Grant Program, which is a UK aid-funded nutrition-sensitive social protection program being delivered in Jigawa and Zamfara in northwest Nigeria. In order to determine the value of the cash transfer, we had to rely heavily on data coming out of the HEA, and because the HEA informed our cost of diet analysis, we wanted to make sure that that value is evidence-based and that we have the latest data on the poverty levels in the communities where we work.
Ina an sa kuɗi 4,000 wata, ina an sa in sai kayan miya in kakkasa, ina sayarwa ana cin abinci kan dan wani wata Allah ya kawo.
The HEA analysis that was conducted in February in the northeast in Yobe area in Maiduguri was very helpful to tailor our assistance, our food assistance, but as well the value of our transfer. It helped to have a better understanding of the people we are supporting. Thanks to the HEAs, we know that vulnerability is not only based on status, meaning that not only IDPs need assistance, as well host population need assistance.
Has the mandate of coordinating all the form of emergencies and disasters in Nigeria, ranging from mitigation, preparedness, response, and recovery. HEA is very vital and essential in every phase of this disaster management.
HEA methodology can be used for poverty analysis and safety net programming, disaster risk reduction, needs assessment, planning of social protection and resilience programs, project design, monitoring and evaluation of interventions, contingency planning, as well as disaster response and recovery.
Going forward, I want to call upon the government, which I'm also part of, to partner with Save the Children concerning this HEA, because they makes the humanitarian work a bit easier, because when you have accurate data, you can't respond, you cannot do anything without having accurate data. And also I'm also using this to also call the government to try and institutionalize this HEA in Nigeria, because it's very key, essential, and also vital.
The recommendation for the government is to create a budget line for the HEA in order to continue from where ECO stopped.
We wanted government to really assist Save the Children to develop this HEA activity in terms of sensitizing other stakeholders and the policymakers to know that really this tool is working, and this tool is helping toward the budgetary issue, toward identifying people where they are in serious risks in terms of livelihood.
We had to classify the populations that we were assessing by different world groups, and I found this very interesting and very useful for targeting for organizations, especially WFP.
Like it's done in other countries, there will be need to introduce HEA into our university curriculum. I learned that in Niger Republic, they have it as part of courses that are taught in their universities.
For government and other implementing partners, we would recommend that the HEA be utilized to target communities where you work, but also to ensure that the social transfer or cash transfers that you're delivering are adequate to address the vulnerabilities that your program are aiming to address.
I would say it's important both for the government and developing partners to have that continuity, having HEA, because a lot of work that goes on both on the development side or even for the planning for the government, you have to rely on the IPC classification, and HEA is one area where you get information on where, at what stage are people under famine, is it emergency, is it crisis, that kind of classification. If you don't have that information, you cannot plan for people in any area.
Our expectations from the government on HEA in Nigeria are institutionalization of HEA in Nigeria, with the National Emergency Management Agency NEMA as the lead agency. Provision of financial support to NEMA to lead the HEA activities in Nigeria through the inclusion of HEA Fund in the annual budget. Possible expansion of HEA coverage across other states in Nigeria to better improve the early warning and response systems, and as well as provide holistic information to the National Social Safety Net programming of the federal government. State government support for agricultural development programs ADP in order to strengthen the information management system and effectively support local farmers towards improving agricultural production in the states. Our expectation from donor agencies on HEA in Nigeria is the need to support the government to fill any gap in the budget support for HEA-related activities to ensure continuous information on early warning and response systems in Nigeria.